So I would like to welcome everyone to today's IHI session. Well, actually, it's the Lone Right Care Week session on what worries you the most about healthcare costs. My name is Kara Jefferson, and I am a faculty member at Frontier Nursing University, and we're going to just have the discussion with a couple people that I know. So everybody I've asked everybody so far, what worries you the most about healthcare costs? You filled out these information sheets, but before we get started, I want to give you a few facts about healthcare costs in the United States. So how expensive is healthcare? According to the Center for Medicare and Medicaid Services, Americans spend more than $3 trillion on healthcare in 2016, and that's $9,990 per person on average. The average deductible for employer-sponsored plans increased 63% from 2001 to 2016. The United States spends twice as much on healthcare as Korea, but our infant mortality rate is nearly twice as high, and this is from the CDC, the Centers for Disease Control and Prevention. So who is affected by these elevated costs of care? 29% of Americans say they or someone in their household had problems paying or an inability to pay medical bills in the past 12 months. Additionally, more than 1/3 of insured cancer patients faced out-of-pocket costs that were greater than expected. And on the other hand, the top healthcare CEOs are making more than $250 million a year. So how are us lay people affected? Almost 8% of American adults say they have skipped doses, taken less medicine, or delayed filling a prescription to save money. More than 12% of insured working-age Americans report that they used up all or most of their savings to cover their medical bills, according to the New York Times. And the Kaiser Family Foundation reports that 21% of working-age Americans report cutting back on household items to pay medical bills. So what do y'all think about that?
It's horrendous.
What about it is horrendous?
That people have to go to those measures in order to afford health care.
The thing that gets me is that you can go right north of the border of the United States into Canada and buy medicine, get medicines for way cheaper than you can buy them here in the United States. You can go to a lot of these third world countries and get health care taken care of, and it costs you less than it would do if you had to go to and do that same thing right here in the U.S.
But you know how they justify that? Because I've asked about that. They said in those third world countries, some of that medicine is mixed like in the bathtub versus a clean lab like they do in the United States. That's why the cost is more.
Yeah, but that same, if you use that analogy, the same medicines you can get in Canada, they're not mixed in a bathtub. You go to the hospitals, I don't think the hospital medication that they're giving these people are mixed in a bathtub. Let me give you an example. A friend of ours we went on a trip. His wife fell and broke her wrist. Took her to the emergency room. She got treated, brought her back. 2 days later, she got treatment. The whole cost of all of this stuff was less than $50. Wow. Go to the emergency room now and see what the cost is going to be.
I know.
It's going to probably be 20 times that.
Most people will go, that's why the urgent cares are springing up, because people can't afford to go to the emergency room. They can't afford to go to the hospitals.
You're absolutely.
But I have seen a case where the urgent care, going to urgent care without insurance costs you almost as much as going to the hospital emergency room sometimes.
Yeah, I agree with that.
Mm-hmm.
Well, as somebody who's worked in both the hospital and the emergency room, that I can say that for most urgent cares, the reason that the insurance pays whatever the insurance pays. Most of them have some kind of contracted deal with insurance companies. And so the insurance company agrees to pay them X amount of dollars for whatever the billing code is. So let's say that billing code is, which is, a bit much for this conversation, but let's just say that it's billed as a level 4, 99214, meaning it's a repeat person who comes back. And they're estimating that that service is going to be $159. That's why a lot of urgent cares for self-pay patients charge the self-pay people $150 right up front, because they know that they're going to recoup that $150 back from urgent care. The other thing that's interesting about it is some insurance companies form these deals with urgent cares, and they say, okay, listen, you can do everything under the sun for this patient. That patient can go in, you can give them 5 shots, you can do an x-ray of all their body parts, you can give them IV fluids, but at the end of the day, all we're going to pay you is $180. So it just kind of depends on the contract with the insurance company. My card, I don't know if you can all see what it says, but what worries me the most about healthcare costs is that I have a pre-existing illness. And right now we're looking at legislation that they're trying to repeal this, where right now my pre-existing illness is covered by my insurance plan. So what happens if they take this away? How much is that going to cost me? Which leads into my second thing, which is being unable to afford medications. Right now, the cost of my medicine actually went up. When I started the medicine, it was, what they bill for it was $18,000 plus. The other day I got a statement in the mail and it is up to $19,869. So in less than a year, my medication has gone up almost $1,000, which is ridiculous. So I'm one of those people that I don't have a choice but to pay these ridiculous healthcare costs if I want my medicine.
And that's the problem, because you got people that they don't go to the doctors because they can't afford the cost. If they go to the doctor, they know they can't afford the medicine. So if you go to the doctor and he gives you medicine, what are you going to do? You're not going to get the medicine because you can't afford it. It's crazy. I mean, I don't know what else to tell people, but that's also one of my main concerns is, as the population ages for people like myself, as we start to get older, you start to run into more physical defects. You start to run into more medical issues. And when you're young, a lot of young folks don't worry about it because they're working. But when you're not working, that's a whole different ball game. Now you're truly on fixed income.
That's true.
You know, there was a time you could make overtime, you could move some of that money around and all, but you got a lot of people, and I'm not just speaking for myself, I'm speaking for the general population. A lot of people who just, they're not going to get medical attention because they just cannot afford it. And for a country like ours, so supposed to be a leader in everything, but the only thing we're leading in is making some people richer. Right. Companies, drug companies. You can't tell me that medicine has to cost that much. Well, yeah, I know they got research. I know they got costs associated with getting medicines. I know they got costs and all of that. You got 350 million people in the United States alone. But we're talking about trillions of dollars that we spend in a year. What does that tell you?
And the CEOs of the top healthcare companies are making more than $250 million a year. Does that make anybody mad except for me?
It's
Of course
surprising.
it makes you mad. Go ahead, Sian. I thought you were saying something.
No, I'm just saying it's supply and demand. I mean, they know there's a market for it. You have to have it. So if you have something like cancer or diabetes or something that most people have, they're going to use it to make sure they can mark up the prices.
Another thing, and that's my own personal belief, is that we don't hold people accountable. We're not holding the federal government accountable. We don't hold doctors accountable. We don't hold insurance companies accountable. But yet, still in all, the bottom line is how much money we make. It's not about saving lives, because some lives don't matter. If the cost is greater than or too great, it just don't matter. You know, we've lost, how would I say this? We lost the ability. There was a time when doctors would go to your house to see you for people that couldn't travel. And they wasn't worried about cost and being rich. But how rich is rich when you don't have your health?
Right. That's a good point.
So what do you think would be a solution to any of those things? And not necessarily you, Daddy, Ray Jefferson, because I should be calling people by their names, but anybody.
I ain't scared. What they gonna do me? We need to get more people engaged in talking about this instead of just mumbling to themselves. I hardly ever see this on a ballot. We put everything on the ballot except the things that people really need, especially the people who aren't the rich people. If you're rich, you ain't worrying about health insurance.
Also, we need to have people who are voting for them, not like the senators and congressmen and all the people who are voting for the average person's health care are the ones who have full health care from the time they start that position until they die. So they don't care what they vote for either way because they are covered and their families are covered. So we need people like you said, making you a normal person vote for it because that's the person who's affected. When John McCain first came out and he voted against voted for the repeal of Obamacare, he had just been diagnosed with brain cancer and he still voted against it because when he left that hospital, he knew everything was covered for him. So he didn't have to worry about that. And then after getting scrutiny, then he came back and voted against it because he was like, every American deserves what I had. But as soon as they found out he had a tumor on his brain, they operated and they did it so well that he was able to get on a private jet to DC to vote against healthcare for everyone. So we need people who aren't in the minority of people who have good coverage voting for what coverage should look like for the everyday person.
I'll tell you another thing that should be looked at is that people who are, especially your senators and representatives who are tied to these insurance companies, who get money from these insurance companies to help push these kind of bills through, to make sure that the medicines cost you an extra arm and a leg. They're not trying to do anything to try to make costs go down, but they are lining their pockets. So just like you hold universities accountable for, I'm just using this as an analogy, your whole university is accountable for the kids that go over there and participate in sports and all these other activities. Well, those kids can't get money. University can get it. But what happens when somebody finds out that money's being funneled? People lose jobs. You don't find that happening in the Senate. You don't find that happening in your House of Representatives. This is what I'm talking about when I say accountability.
That's a good point.
The most they do is finger point, and that's it until something else comes up, and then they move on.
So, Brandy, what worries you the most about healthcare costs right now?
Honestly, it just keeps going up. I mean, I have a pre-existing condition, and I had to sacrifice a lot, but I got lucky because I am covered. But it's scary because it's like, for how long? Because, I mean, that's in jeopardy too.
So what would you like to be done?
they need to listen more to the little people per se. It shouldn't be just the people that are in the Senate or in Congress to speak for everybody. Because at the end of the day, it's not really directly affecting them. It's affecting more the people that don't have a voice.
So how do we get people who don't have a voice to care about some of these issues? Like, who would be willing to stand out there and go out on a limb and say, hey, I'm going to run for one of these offices because of XYZ? We don't see that very often.
That's the thing. It's not going to happen because, let's face it, you have bigger people that are more well-known and have more money, so they have more support to get the votes versus a little person that really needs it that could help more of the people that can't afford to get it themselves. So it's like, it's honestly, it seems like it's a lose-lose situation. I have no idea what needs to be done, but something needs to be done.
Exactly right, Brandon. And you hit the nail on the head. Money breeds money. And when you start messing with people's money, especially the bottom line, that's when the cutthroats come out. I mean, rich people got more money to get the votes they need to get what they want. That's why they got lobbyists. What you think a lobbyist does?
Exactly.
That's what they do.
People in line to do the dirty work. It's like, okay, well, if this one doesn't want to do it, I have somebody as backup to do it. If that person doesn't want to do it, I have that person to back up to do it. Meanwhile, a little person probably has a group, but then it's like, if you're the leader of the group and you're like fighting for the cause, but then you get shot down, you're just gonna give up easier because you don't really you don't have the backing that the big wigs have.
I mean, this isn't something that's going to happen. This is going to happen gradually and over time. It's not going to be overnight. But I think a big part of the fact that we complain about a senator voting, someone voted him in. So there needs to be some type of an education piece for people to, one, we say like go vote or whatever, but people, even those, I mean, when you go vote, besides voting for the people, there's usually certain little things and you're like, oh, I didn't read that beforehand. I just click yes or no or whatever. So there needs to be a bigger education piece or more money toward educating the public on what that means to them so that when they are voting, they're actually reading a person's platform that says doing a little more research where you can see that half of their campaign was backed by Blue Cross Blue Shield and they're against healthcare. So you know that they're going to be pro higher costs or, I think education is one of the biggest things because most people either just don't vote or they don't read, they don't look through it. And so they just click a button to say they did it. We vote those people in. So we gotta start somewhere and really educate people on what they're voting for.
Exactly, because I know I think it was the election for Obama, they said that a bunch of people voted, but they just went down the line and they voted for more than one person for president because they didn't have the education to know that you only click one. They just saw all these names that they recognized, and that's what they chose.
Sometimes you don't have a choice.
You really don't. Sometimes
this last election was a great example.
You have to do what they want you to do, or you're gonna feel long-standing repercussions.
That's right. You're damned if you do, you're damned if you don't. But if you don't know the issues, and another thing is that our government is so big, nobody knows exactly what's going on in it anyway.
Right.
Nobody knows. The left hand don't know what the right hand's doing.
And all they do is finger point.
And nobody knows the platforms that all their senators and representatives, how they vote on all the different issues. Because that's a lot they say it's a lot that you have to look at. You would be surprised if you really took notice at how many times your representative didn't even show up for a vote.
Right, but
I
you
know
don't,
I
you
will.
don't hear about things like that.
No, you ain't gonna hear about things like that. You're not gonna hear about somebody who's sick and passes away because they couldn't afford medication, because that's not news. That don't splash the headlines. That don't get a vote.
So do you think that if there were more sessions like, let's say like this, but not held virtually, but like if there were some kind of cafe or some area where like somebody, maybe even somebody like me, went around to churches or any kind of event or Sion or whatever, and you discuss these issues and you told people, because you were saying how one of the problems is people aren't educated enough about the topics. And I know, especially when it comes to things like amendments, when you have to vote on amendments. So if it's something as simple as like amendments, they write all this stuff in language that lay people cannot understand. So I think a lot of times people get frustrated when they read those things because they're like, I don't even know what I just read. So that's just for ordinary people who might have some education, but then you think about the people who are possibly less educated and can't read that and can't write. So what do you do about that? How do you get the message that healthcare is important? And as an example, let me give another example. I had a lady that I saw, and she told me she waited to go to the doctor. She'd been having the same symptoms for like 10 years, but she didn't want to go because she knew that she couldn't afford to go. So the only reason that she came is because her family finally told her that she was going to come, but she was like, honestly, I know I'm about to die. So at this point, it doesn't even matter. Like, how sad is that? Like, you shouldn't have to go to the doctor because your family's forcing you to at the end when you already know that you've got something bad and you might not live from it. What does that say about our society?
It's a little jacked up.
I mean,
Well,
it's
a lot of jacked up.
reality. It sucks, but I mean, people, am I going to pay, you know, if I'm a lower income family, am I going to pay to keep my lights on, or am I going to pay to go to the doctor when it's going to take me out anyway? I mean, it's morbid to think about, but people are just like, you know, they have to prioritize, and that doesn't fall into one of them. Let me take an aspirin and keep it moving, especially the old people. And so, I mean, I think what you're saying as far as going places, it's laying it out. I always read in marketing that you have to make things at a third grade level. Like, you should always write things at a third grade level so that everyone can understand. Shout out to Chloe. You could even understand it. I mean, you have to make it as easy as possible for someone, I mean, to be able to understand it. Read that amendment and then say, okay, now what does this mean to you? And it's, you know, it's like you said, the churches, it's these health fairs that people have. It's these little things where your everyday person is going to go to get information, your clinics and things like that, where they say, oh, I just clicked yes, and I had no idea that they were going to take away this from me, or they were going to take away that. And I mean, especially being a woman, and you hear all the things healthcare-wise about, one, pre-existing conditions, but two, you know, like birth control and other things that they're taking away or making more expensive, that, you know, you have these men in suits voting about women's rights and like reproductive rights and all those things. You're like, hold on. Like, until you get a cycle, you can't vote on that for me.
Right.
Like, you know, it's really educating people on the bottom line and what it really means and how, you know, how it affects you so that they can start voting in the right direction. So at least we can get some legislation behind it, and then we can start to make an impact.
Very good.
I agree. So what worried you the most, Mama, about Evelyn, about healthcare costs?
You see my people?
Yes.
Oh, y'all typed it.
They are cutting so many drugs and health services from insurance plans. That's a big thing. I think one of the overarching, you know, messages that I'm hearing is a lot of this all ties back to politics, because insurance costs versus prescription drug companies, they all kind of factor into the same thing. And all of that is dictated by what healthcare plan you have, which is dictated about from your state and who your state decides to participate with. Because every state does not have the same healthcare plans. Blue Cross Blue Shield of Louisiana is completely different from Blue Cross Blue Shield of Georgia. Right?
I agree.
Agreed.
And Carol, what do you think about all this? We can't hear you. Really?
Tell me.
She needs to get closer to the computer. I can't hear.
We can't hear, and we're being recorded. Yes.
Hers is, this was her. Can you see it? Sorry, I think I'm going to put it up.
Higher deductibles. We were thinking alike, because my last thing, high deductible plans. So, yes, we are paying, in addition, you know, it's not just costs over medication, it's the actual cost of insurance plans. Right now, for 2 people, I am paying almost $1,000 a month for health insurance. But I have no choice.
Goodness gracious.
Yeah, I have no choice because if I don't pay it, I can't afford my $19,000 medicine.
And then it goes to the amount you have to pay to reach your deductible too.
Yes.
That costs a lot.
Has anybody ever had any kind of HSA plan where you actually had to save money to contribute to the cost of your medication? Or what happens when you get that big deductible? How do you pay it?
Well, that was when you basically had so much money put aside, that money would go back towards paying some of your deductible. But that would be more or less like an end of the year thing.
Do you think that that is helpful, or do you think that it's really not helpful? Because in addition to the money that you're already paying just to have insurance coverage, that you're having to save extra money. And most deductibles now are about $5,000 a year. So that's what your deductible is. Forget about those other things like your co-insurance, because if you have an 80-20 co-insurance plan, you're still responsible for that other 20%. So you paid a $5,000 deductible plus you're responsible for another 20%. How is this fair?
Life's not fair, sweetie. You get the limit and that's it.
Cliche, but it's true. That's true.
No, I understand what you're saying. Life with being fair when you grow up and have to start taking on paying bills and other responsibilities that come with growing up. You know, the only one life is really fair to right now are the kids, because they can go to bed at night and they don't have to worry about where the next dollar is going to come from to pay medical insurance, going to pay medicine, lights, water, gas, food. They don't have that worry. That's for people over 18 or people that's living on their own.
Yeah, but that's twofold, because although, you know, kids go to sleep at night and they don't have to worry about that, like health insurance, their parents do. And if their parents can't afford it, and if their state has some type of like subsidized plan, then your kid gets sick, then what do? You know?
That's also,
money
the kids do not worry about health care or health insurance or none of that.
Right.
The parents worry about those types of things.
Right. But then where do you draw the line? When you're taking it away from the parents, like the government, you're also taking it away. You know, you're saying, okay, you should do this. Well, then the senators and all that, you're taking it away from the kids too, because now they, you know, they can't go. Kids get sick the most because they're around kids.
Once again, that goes back to what I call accountability. When you make the government accountable, You make them accountable for the monies that they take away from you for taxes and everything else and how they're distributing that money. Then you have money that should be able to give back to the people to try to help them lower some of these costs. I mean, Vice President just got on a jet, cost $300,000 to fly from where?
30 minutes.
Texas to Indiana to go to a football game to stage a show. Who paying for that? How much could that money be used for something else? Your president takes
Golf tournament.
plane and jet to go play golf in Florida. But when he travels and when they travel, they don't travel alone.
Right.
So there are a lot of things out there that this government does that's not there to help you, but you don't pay your income tax and see what happens.
Right.
Right. So do you think that if we had some kind of healthcare system like Canada or Sweden or one of those, do you think that things would be better? Do you think that honestly, if Medicare or Medicaid paid the same amount of money as a private health insurance company, that you would have better access to care, less expensive health care costs? Do you think that would work?
You gotta ask yourself, is it working in Canada? Is it working in Sweden? There are other places in Europe too that it is working.
At the core of it, I think it's working in these other places. And if you have, I don't want to say healthy people, because that term could mean a lot of things, but if you have people who are healthy, then in turn they are working. They have health care, they can go to work, they can do certain things, and then that money is still being generated and put back into the economy. That's why it works for some of those other places, because those people can thrive and do normal things, and they're putting that money right back into the economy. They're not spending it on health care, but they're working more, doing other things that is putting it right back into the economy. So they're not losing money. They're keeping, their economies aren't crushing by any means, but they're staying afloat because they have, it's not, the rich are getting richer and the poor are dying off. It's a good system. It's a good balance. We should just all do it.
Well, what about, even if you did one of those things, you have to go back now and you have to look, because if you're going to emulate Canada or you're going to emulate Sweden or any of these countries that are doing this successfully, you also have to realize how unhealthy, because Sian just mentioned healthy, how unhealthy America is. You have a fast food restaurant almost on every single corner. In the grocery stores, most of the aisles that people shop down, they're all filled with junk. They've got trans fat, they've got lots of butter. I'm not saying that all these things are bad. Okay, they are. Let's just face it. They are bad because we eat them in such large quantities. But if we went back to picking our own vegetables outside and getting rid of all of this junk in the grocery stores and just having more fresh stuff, how would Americans take it? Because right now, that's what's leading, in my eyes, that's what's leading to us having more and more problems. For example, 60 years ago, nobody knew about Crohn's disease. People didn't really have Crohn's disease or almost any of these autoimmune diseases, but they've developed over the years, mostly, if you ask me, because of the stuff that we're putting in our bodies that we can no longer, our bodies can't handle it. They weren't made for the processing of some of these foods. So how do we educate everybody to say, hey, I know that McDonald's $1 burger is really, really good, and I'm not here to pick on McDonald's, it could be any of them, but how do you tell them that instead of doing that, you have a healthier choice if you go to the grocery store and you buy lean ground beef or lean ground turkey or lean ground chicken and make your own burger at home?
But guess what? Cost plays a factor into that too.
Exactly.
People are going to pick up more so what they can afford versus they're not going to be looking at it from a healthy or unhealthy standpoint. money just rules everything.
And that's sad.
Well, I think that not just that, time is a big factor. Most people go through, well, some people go through fast food restaurants because time-wise, it's simpler to pick something up that's already cooked, even though it's not healthy, than to say to come home and try to figure out what to cook, and you have X amount of time before you have to do homework and clean the house and get the kids to bed and all these other things and still prepare for the next day. So that factors in with how do you spend your time wisely. Whereas if you went to the grocery store, chose healthy things, came home on a weekend, prepped one good prepared, several meals that could last the whole week, and then you just you fixed one meat and then did something different with it every day. That versus going in and out through the drive-through will be more cost effective, but who has the time? Because kids are always in something on the weekends, and parents just know they have X amount of time to get X amount of things done. So that plays a big factor too.
But I'm going to tell you something now. I'm going to reverse everything I've said.
Go ahead.
Since you brought up 60 years ago, that's fine. But you also got to look at mortality rates 60 years ago too. Because people were dying, heart attacks and all these other things. And even with the Crohn's, people had Crohn's, they just didn't know it was Crohn's.
Didn't know about it. That's right. Didn't have a name for it.
Nobody associated a name for the disease.
Mm-hmm.
So when you're talking about the foods that are in the stores now, the difference between now and 60 years ago, you had less processed foods.
Right.
Than what you have now. Because a cow is a cow is a cow. But what you feed that cow governs how the meat comes out.
Yep.
People have been eating beef and pork and all these other things that everybody's saying is bad for you for centuries.
Mm-hmm.
I mean, honestly, I'd love to eat healthier, but if I'm at the grocery store and I have $20 to stretch to make a meal, and I look at regular beef versus organic, or, I'm more so into turkey now anyway, but I'm just saying it to prove it. I'm going to go with what stretches my money versus what's healthier for me. I mean, it's sad, but that's the reality. That's the reality. Sorry.
It's all healthy when you cook it all the way.
Right? Yeah.
Well, I think you're right about the process. It's the way that we now prepare foods, and we use so much stuff that's processed. And I think it's all the processed stuff that is actually leading us to be more unhealthy, which increases your risk for all these chronic problems. It increases your risk for high blood pressure. It increases your risk of hyperlipidemia or high cholesterol. It increases your risk for coronary artery disease or heart disease. It leads to all those things. So, which in turn leads to increased burden on the healthcare system, because when you have a chronic disease, research has shown time and time again that you're going to pay more. The system has to pay more for your cost of care than somebody who has absolutely no healthcare problems.
You're right. But by the same token, 60 years ago, no CEO was getting $250 million as a bonus above his salary. All I'm saying is we've gone through the system now where everything is driven by that almighty dollar. And it's going to continue to be driven by the almighty. Because look, let's not get it twisted. If you don't make money, you're not in business. You're not in business, you ain't making medicine. You're not looking for doing research. You're not doing a whole lot of things. And I get that. But how much more research could we have done with that $250 million that was given away?
Yeah.
What could we
See,
have done to
bottom-
find a cure for something? What could we have
Bottom
done?
line, something.
Go ahead.
Sorry. Bottom line, something has to be done, but it can't just be focused on one area. It has to be looked at from all kind of different areas, because you gotta kind of, once you figure it out, you gotta stop it out at the pass, and it's not gonna just be with lowering the cost of healthcare. You have to look in other areas, or else it'll all be for nothing. It'll happen it'll be like a temporary fix, like a Band-Aid, but the Band-Aid's gonna come off.
I mean, it goes back to what y'all already talked about. It's about education. It's educating people. It's about finding people who are willing to step out of their comfort zone and talk and try to educate people on all of these issues. If you don't bring the issue to the forefront, it's going to stay behind, and the message is going to get lost. So until somebody or a bunch of people start bringing it out and getting it out there, where more people start to get engaged with it, all we're doing now is just talking about it.
I agree. We, like, at our church, they have a Saturday nutrition class. So one Saturday they took you to the grocery store to show you what to buy. It's all of, I don't know, it's unfamiliar. It takes a little bit more time, like Evelyn said, so I'm just not going to do it. So they started going on Saturday mornings, meet us at Whole Foods, and we'll show you what to buy and how it's easier to replace certain things, like getting ground turkey versus chicken or beef, and then all of a sudden they'll taste the same, but you got something
people
different.
love turkey and some people love chicken.
Right, I mean, it's fine, but it's just showing them
I know what you're saying.
they could purchase it, and they made it easy. So then they show you how to cook it, and then all of a sudden, oh, well, that didn't take more time than it took me to do my normal thing. I can do it.
Exactly.
Really just education on how you can change. I mean, we see all the time where people say, I stopped taking all my medicines and I just started exercising and eating right, and all of a sudden now I don't have that issue I had anymore, because they just started taking care of their bodies. So if we don't want to pay, we got to do something. So it's cheaper to pay for the groceries than it is for the pharmaceuticals, then there you go. Go to Whole Foods.
Well, not just Whole Foods. You can go to any grocery store if you shop the perimeter of the store and stay out of those aisles where they sell so much junk.
Right.
Yep, I agree. And I was thinking about what Nanny Reese said about what matters most to her. And she was saying about rising costs, but she really doesn't have to worry about the rising costs, because you have Medicare. Is it Medicare you said?
Medicare plus insurance.
Okay. So my only concern is, which is great for you, but what happens when I already feel old, but the youngest person on the call is Sion. So what happens when Sion gets older and she needs Medicare? Is Medicare really going to be there?
No.
We have no idea.
I'm just
We've
going
talked
back.
about that for years.
So is the system going to get worse, or is the system going to get better?
That's a good question. And only time's going to tell.
Yes.
I don't know if the system's going to
And
get
I
better.
can honestly say I don't think I'm going to see it get any better in my lifetime, because I've seen it gradually get worse over the last 40 years of my life, I should say.
What were you saying, Sion?
I was saying, I don't know if it'll get better or worse, but I know that money, the whole point of before, the basic part of the economy that you learned was you put it in, when you need it, it gives back to you. So while a 25-year-old is working and paying, a grandparent is getting it, but when it flips, it'll be the same thing. You'll reap the benefits later, so then you reap kind of thing. But I feel like the money that I'm putting it as a young worker is not gonna, it's gonna more so go to pay some of the debt that we owe, instead of by the time I get there, they won't have that program anymore. They won't have, it would be obsolete.
I agree.
I'll just start saving my coins.
So what did you write on your paper for what mattered most to you?
I said, prices with lower coverage.
Increased prices with lower coverage. Okay.
So basically, like my monthly cost versus when I actually go to the doctor and they give you the bottom line of, if we do this, you gotta, you know, whatever, or you go to the doctor and they give you a script, and when you get to the pharmacy, they call you and they say, do you want to fill this because it's $200? Have insurance, and they say, oh, it doesn't cover it, and you're like, oh, cool, I pay $200 a month and I can't even get some nasal spray. Cool, thanks. So
That was actually on my daddy's, was it on my dad's or my mama's, who said what happens when you go to the pharmacy to pick up your medicines and you can't even get the medicine that your doctor prescribed because the insurance company.
That actually happened to me. I got the medicine a year ago and it cost me like $5 to get the same medication, because now the insurance company says there's a different medicine. But the doctor gave me the same thing he gave me before. And this is a Friday. They called me up at about 6 o'clock on Friday, so you know the doctor's out.
Mm-hmm.
Well, I could still get the medicine if I wanted to pay him $300.
Oh.
So, hey, I did without the medicine.
And I think that's the problem with our system is people who truly need their medicine. I feel like, whereas I feel like, yes, there are some medicines that are way more expensive and we can try other versions before, but if you've tried it before, why do you have to go through this process of them making you do it before? If it's a medicine that you have already been on and it has been shown to help you, why are we doing this? What has our country come to?
But if it's a new medicine, let me tell you something happened to me. I had a dermatologist to prescribe some medicine for me. And I went to the pharmacist, I couldn't get it, $300, this for a tube. That's one medicine, she had about 4 of them for me. I went to the Good RX online, it gives you the different pharmacists and how much you pay for it. I went back and told her I couldn't afford it. I don't know how she did this, but this lady called the drugstore in Lafayette. They gave me my medicine for free. All the medicine she prescribed for me, I got it free. How did that happen? But I'm looking at 300 and 400 and 500 for different tubes of medicine. I got them all free.
I think with that situation, a lot of times, sometimes there are different pharmaceutical reps that go around to different doctors' offices. And so I know, like, especially for eye drops, I tell people all the time, because like for pink eye and those kind of things, medicines that I prescribe stuff a lot of, they're expensive. Moxiza is very expensive. Ciprodex eardrops are very expensive, but one of the advantages that I have is people who know those medicines work. I have a pharmaceutical rep that says, you know what, when you go to the pharmacy, this will not work. So I have gone and I spoke to the pharmacist and I have given them this coupon code that's valid for XYZ. So if it doesn't run through with your insurance, you can use these coupon codes. And so then they also gave me the website to give to patients. So like when you get to the pharmacy and your Moxiza eye drops are $250, you simply pull up your phone and go to drops101.com and it pulls up a coupon so that they can get a discount. So I think that's a lot of work, and people shouldn't have to go through all that to get medicine.
They shouldn't. And how many people are going to do that?
A lot of them won't. They won't. They'll either say,
well,
I don't want
just,
the medicine.
Before, you know, Evelyn said those who want to save. Well, everybody wants to save. At the bottom line, if it gets to be 2%, you just don't even worry about it. Then you go back to the old buggy treatment. Well, try this, try that. You know, everybody got an opinion on whatever, when something happens to you, what you ought to be taking for it. So, you know, you see that? You self-medicate. That's what people do.
Not good.
No, it's not always good.
Or they say, oh, I know Joe had this problem. And they call Joe, yeah, I still got a couple of them pills left. Oh, well, I'm going to come get them.
Not good, yep.
I mean, it happens all the time.
Yep. So pretty much everything that we've heard today, I'm going to recap, and then I'm going to ask everybody to go around, tell us your name, tell us your age, and tell us where you are.
Ooh,
Yes.
This ought to be interesting.
We got to go through that. We got to go through that, girlfriend.
Yes. But pretty much, well, we can actually do that first, and then I'll recap. So I'll start with me. Like I said in the beginning, I'm Kyra Jefferson. I'm 39 years old, and I'm from Louisiana, but I'm currently living in Atlanta. Who's next?
My name is Evelyn Jefferson. I'm 59. I live in New Iberia, Louisiana. I'm Kyra's mother.
I thought you were older than that. I'm Ray Jefferson. I live in Louisiana too.
Sure.
Well, sometimes I don't know. It all depends on where I wake up. 3, and yeah, we got to do something to try to get these costs down.
You want the old folks down?
Okay.
Marie Chevalier, New Iberia, and I'm at home. Oh, I'm 71. Young 71.
Y'all are up.
Sian Baptiste, I am 25, not the youngest because Chloe's 8. And I am in Atlanta, Georgia. Had to think about it for a second.
Carol Perro, 49, visiting Atlanta.
Okay. And we lost Brandy Jefferson. She is in Albany, and she is like in her mid-30s, I'm guessing. So pretty much to recap, we have all said that the thing that worries us the most about healthcare costs is that they keep rising. Number 1, primarily due to high deductible plans. Number 2, because medications keep going up. And what we've determined is that it all goes back to accountability and politics. And money is the ruler of everything. So without money, you just can't have the medicine you need. Oh, Brandy's back. So Brandy, everybody went through and they told us their name, where you are, and your age.
My name is Brandy Jefferson. I'm 36. I'm in Georgia. And did I get everything?
Yeah, we know you're in Georgia, but it would have been good to say where in Georgia.
Oh, I'm in Albany, Georgia. Sorry.
Thank you. So I would like to thank you guys for, making this last hour part of your evening and joining the Lone Institute for Right Care Action Week. I hope that this might inspire you to go and be one of those people who gets outside of church and starts talking to people about the rising cost of healthcare, because it's only when we talk about it enough and get more people behind us that you'll actually get the resources to try to impact some kind of change. So if that person has to start with me, woohoo, let's do it. So thanks.
Thank you.
You're welcome. Thanks.
Anybody have any concluding words before we hang up?
Now I'm going to eat someone else's food.
All right.
Pork chops.
Pork chops do not have to be.
Bye.
Bye, everybody.
Bye.
Bye. Thank you.
Disconnected.